questions from the media for the people I just listed once Governor Ige has completed his remarks and presentation. And if you would like to follow along on the governor's presentation and see his slides, we're on the governor's Facebook page. Just scroll down to the live feed and you'll see a link to click on. Click on that link. With that, Governor Ige.
Good afternoon. Over the past few weeks, my office has been working with the state, county, and community partners to align on a strategy to reopen and reshape Hawaii's economy. The last few months have been challenging, and I'm thankful for the people of Hawaii's commitment to protecting and taking care of one another. The Reopening Hawaii strategy I'm presenting today conveys Hawaii's coordinated, statewide approach to jumpstart recovery from the COVID-19 crisis and provide an informed way forward during this unprecedented time. I am incredibly proud of the progress we've made together as a state. We took public health measures seriously and we flattened the curve in Hawaii. Through our safe practices like washing hands, physical distancing, wearing face covers, and staying home when sick, we've achieved safe results. Because of this, we're seeing a consistent downward trajectory of new cases, a 90% recovery rate, and our hospitals that were once bracing for the worst have significant surge capacity. We also have the lowest fatality rate in the United States. That being said, we have to work together and empower ourselves by acting with care and taking personal responsibility for Hawaii's safe reopening. While we are announcing a strategy for a phased approach to reopen, we need to expect that COVID-19 activity will continue. Our health experts agree that one or more of these outcomes will occur while we learn to live safely with COVID-19. One possibility is that treatments and containment methods increase survivability and decrease pressure on Hawaii's hospitals and healthcare providers. The second possibility is that our population develops a natural immunity to COVID-19, referred to as herd immunity. And the third, longer-term possibility is that a vaccine is developed and at least 90% of our population is immunized. We can feel confident reopening knowing that Hawaii's healthcare and public health systems are ready and continue to increase testing, contact tracing, surveillance, and quarantine capacity. Hawaii has done an incredible job of flattening the curve, but we also are aware that battling COVID-19 had significant social economic impacts. In April, I presented the Economic and Community Pathway to Recovery, a framework that charts the course toward Hawaii's resilient future. Today, I'm sharing this first step of this pathway, a strategy to gradually reopen and reshape Hawaii's economy beyond recovery. My first priority is to save lives and prevent suffering. Second, we will empower individuals with safe practices. Third, as we reopen Hawaii's economy together, we will reshape it to be stronger and more resilient. Our strategy includes 4 phases as the roadmap to Hawaii's recovery and resilience. Each phase corresponds to impact levels informed by Hawaii's health, economic, and community-based indicators. Phase 1, stabilization, focuses on healing Hawaii by saving lives and flattening the curve in our communities. In the last few weeks, we've stabilized by reopening low-risk businesses such as floral shops, pet grooming services, and car washes, while transitioning from stay-at-home to safer at home. Because of Hawaii's success, we are preparing to transition from the stabilization phase to heal Hawaii into the reopening of our Kama'aina economy. Phase 2, reopening, celebrates Hawaii's Kama'aina economy and is informed by acting with care. In this phase, we start to reconnect Hawaii's local activities by gradually reopening medium-risk businesses and activities, followed by high-risk businesses and activities. Phase 3, long-term recovery, is where we renew and rebuild Hawaii's economy through a planning and policy discussion to incorporate transitional workforce modernization opportunities, support economic diversification initiatives, target the development of emerging industries, and advance long-term resiliency planning. At the recovery impact level, we will focus on reopening highest risk businesses and activities while remaining cautious and adjusting our safe practices as needed. We can expect this phase to take much longer, since this is when we will be reshaping Hawaii's economy. Phase 4, resilience, is Hawaii's intended outcome. Together, we will emerge stronger and more resilient as a result of learning from and overcoming this challenge. As we move forward, I will consult with subject matter experts, county mayors, and our community to make informed decisions to safely progress Hawaii's reopening. Under this strategy, counties may choose to relax stricter local orders at their own pace in coordination with my office. A minimum 14-day observation period between decision points will allow time to assess conditions before moving to the next impact level. If we see disease activity that threatens to overwhelm Hawaii's systems, we have the ability to reinforce capacity to effectively manage a surge in cases. As a safeguard, we can consider the option of moving backward. Our estimated timeline for reopening reflects a careful step-by-step process with a minimum of 14 days between decision points to assess conditions. In early May, we first reopened low-risk businesses and operations during our Safer at Home impact level. Today, I signed the 8th Supplemental Emergency Proclamation related to COVID-19. As part of this proclamation, we are transitioning the state from Safer at Home to Act with Care. The 8th Supplemental Proclamation has a new exhibit which frames the overall reopening strategy for the state. I'm in frequent communication with county mayors, and the specific details about what is open, when, and how will come from the counties with my approval to ensure coordination with the overall strategy. Act with Care means exactly that. With more and more businesses opening throughout the state, it is up to all of us, the businesses and the general public, to make sure we take care to keep each other safe. So when you go outside, that includes physical distancing, good hygiene, and following all safe practices that have been put in place. Additionally, the 8th Supplemental Emergency Proclamation extends the 14-day traveler quarantine, including, for now, inter-island flights. It also continues the moratorium on evictions for non-payment of rent through the end of June. Finally, because life's happy moments continue to happen, marriage ceremonies may be conducted by real-time audio and video communications so long as all the parties are physically present in Hawaii and all other requirements are met. Assuming our disease activity remains manageable, beginning in June, we will begin to gradually reopen first medium risk, then high risk businesses and operations. It is important to act with care by maintaining physical distancing and safe practices throughout reopening to protect the health and safety of the people of Hawaii. Hawaii's reopening strategy for businesses and operations is informed by the World Health Organization, the Centers for Disease Control, and Johns Hopkins Public Health Principles for a phased reopening based on contact intensity and number of contacts. I am committed to making decisions based on data, science, and best practices. As we progress through each impact level, it's vital to act with care. Specifically, throughout our Safer at Home and Act with Care levels, public health experts recommend wearing face coverings, especially when it is not possible to keep more than 6 feet of distance between yourself and others, and continue to follow recommended safe practices. While we are now making exceptions for businesses and organizations to open their doors, we need to continue to protect our high-risk populations and kupuna. We still need to limit gatherings. However, we anticipate a gradual phasing in of larger gatherings as we progress through the impact levels from 10 to 50 to 100 people or more. Each impact level is designed to monitor health determinants based on Hawaii's disease activity and health capacity. The stay-at-home impact level means that COVID-19 cases are surging or increasing, and we risk insufficient testing, hospital capacity, or contact tracing. The Safer at Home impact level indicates that new COVID-19 cases may occur, but the overall trend is decreasing. Because we took care of our community during the stay-at-home period, I announced the opportunity to reopen certain businesses on May 5th. We are now preparing to reopen medium-risk businesses and operations beginning in June, so long as our disease activity remains manageable. The Act with Care impact level anticipates some new COVID-19 cases, which are manageable, along with improved capacity utilization for testing, hospitals, and contact tracing. The recovery impact level occurs when new COVID-19 cases indicate sporadic activity and optimized capacity utilization for testing, hospitals, and contact tracing. During the recovery impact level, highest risk businesses and operations will be looked at for reopening. The new normal impact level means that we have adjusted to living with COVID-19 through a potential combination of effective treatments and containment methods, natural herd immunity, and vaccines. The safety of our community is our top priority. We are relying on tried and true public health pillars of prevention, detection, containment, and treatment to protect the people of Hawaii. To ensure the safe reopening of Hawaii, we are participating in extensive community dialogue to help everyone feel safe as they go back to work and daily life. We will continue monitoring health metrics with every decision we make. We are committed to decisions based on data, science, and best practices. We are mindful that every action we take serves the interests of the health and safety of the people of Hawaii and will come out stronger than before. This Beyond Recovery strategy to the reopening, recovery, and resilience of Hawaii is a collaborative, comprehensive, and unified effort with many stakeholders. Keep up the good work. Your friends, families, and neighbors are counting on you to stay the course in our battle against COVID-19. So please take care of yourself, take care of each other, and most importantly, help to take care of our community. Thank you.
Thank you, Governor. And with that, we'll open it up to reporters' questions. Again, for the reporters, we have in-house here Kenneth Hara, Director, Hawaii Emergency Management Agency, Alan Oshima, Economic Recovery and Resiliency Effort, Claire Connors, Attorney General, Bruce Anderson, Director of the Department of Health. Governor, your first question comes from Lauren Day, KHON2. She asks, Mayor Kirk Caldwell said with your approval, Oahu restaurants can reopen dine-in services June 5th with restrictions. What are those restrictions?
Certainly, you'd have to check with the City and County of Honolulu. Some of the restrictions include improved health and sanitation activities, guidelines like ensuring that menus are sanitized between each customer, and other activities. I would encourage you to go to the City and County of Honolulu's COVID-19 website.
Governor, this is from Max Dybel, Big Island Now. He's asking, what businesses are considered medium-risk businesses?
Medium-risk businesses, I think, if you look at the chart, they deal with those businesses that occur with intense face-to-face contact of 30 minutes or more, or those businesses that deal with contact with lots of different individuals through the course of the business activity. Those include things like restaurants and other, I suppose, hair salons and others. The presentation does have a chart that includes all of the businesses. And as you see, the businesses opening in the Act with Care phase are the ones that are medium risk.
Governor, this is from Daryl Huff, HNN. Hawaii is reopening more slowly than many places on the mainland that have fewer cases or have, Daryl, I'm not understanding this part of your question. Anyway, if you believe the virus is not widespread in our community and with few people coming in, why not be more aggressive about reopening?
The most fundamental, important point to drive home with everyone is we need to learn to live with COVID-19, which means that in all of our daily practices, we need to wash our hands, we need to understand we stay home when we're sick, we need to isolate if we have symptoms, and most importantly, implement social distancing in everything that we do. Yes, some others may choose to accelerate those activities in a quicker fashion. We believe in consultation with the health experts and the county mayors that we wanted to take a measured and reasoned approach. We want to slowly increase activity and monitor the number of COVID positive cases. We have limited healthcare resources here in the islands. And unlike any other state, we can't drive to the next county or drive to the next state to get access to hospital care or intensive care units. So we want to be smart about the reopening, and we want to be systemic and systematic in reopening activities.
Governor, this is from Jennifer Kelleher with the Associated Press. What are the measures for a surge in cases that would require reverting back to restrictions? An increase of how many cases and over how long would warrant reverting back to the restrictions?
We'll be monitoring the case counts every day as we continue to do so. We were thoughtful and we do anticipate an increase in the number of cases. We don't have an explicit bar that needs to be adhere to. What we are looking for is our capacity to test, our ability to respond to a cluster or an outbreak, and most importantly, our ability to identify close contacts and manage and contain the outbreak. And we have been able to do that successfully with all of the COVID positive cases to date. And so long as we can manage that, there is no explicit threshold of COVID positive new cases that would trigger stepping back.
Governor, from Kevin Dayton, Star Advertiser, he asks, where exactly on the continuum is lifting of the 14-day quarantine for people arriving from the mainland, and when do you expect that will happen?
The quarantine is clearly not a part or embedded in any of the phases. The quarantine is really our ability to require quarantine for anyone entering the state. We are considering what conditions we would feel comfortable with lifting that quarantine. We also are looking at the inter-island quarantine. And both of those are really decisions that are separate and not tied to any specific phase.
Governor, this is from Ashley Mizuo, Hawaii Public Radio. How long do you think it will take to get to a point of herd immunity? And what would be the estimated death toll, considering it appears that less than 1% of people in Hawaii have currently been infected with COVID-19? Are you anticipating this to happen before there is a vaccine? This is for you, Governor, as well as for Dr. Anderson.
Certainly, I'll ask Dr. Anderson to respond as well. But, clearly, our healthcare system has performed terrifically on behalf of all the people of Hawaii. If you look at the percent of COVID-19 positives that require hospitalization, at 12-13% of the cases, we're significantly below the levels that we see in most other communities and states across the country. By the same token, the fatality rate of less than 1% is the lowest in the country. So our healthcare system has performed tremendously well, and we do anticipate that we would be able to manage that in the best way going forward.
Dr. Anderson, did you want to follow up, or? Thank you, Governor.
Yeah.
The ability of a community or population to effectively resist a disease depends on lots of factors. We had a similar situation with H1N1, with SARS, with Ebola recently, and far less than 1% of the population ever became infected. And it was because of the surveillance systems that were in place. In some cases, there was good therapies made available. And mostly it was about identifying contacts and tracing cases quickly when they occurred. We were able to keep this disease under control. So although herd